5 core main components of this response which really contributed to this success. The first one was the high level of community participation, community awareness, and the level of involvement of community leaders that made it very easy for the public to come forward and accept the measures that are being put in place. The second one was a very strong coordination of the response led by the Ministry of Health on the ground and supported by the different partners across the different levels at the provincial level and in Kinshasa, which ensured that we had proper allocation of resources, there was no duplication, and gaps were rapidly filled. The third one was ensuring we had access to medical countermeasures. So as you know, for this particular strain of the Ebola virus, we have a vaccine which has been licensed, and there were already vaccines pre-positioned in Kinshasa. So we swung in quickly, moved these vaccines to Bulape, and were able to administer, and we got additional doses that were administered. So in total, over 47,000 people were administered in this response. And then there were also therapeutics that are used for managing severe cases, which were also made available. So those countermeasures really helped. Then there is the issue of ensuring that we had community protection. And that is very, very essential in terms of safe and dignified burials being done to prevent transmission during burial of people who died from Ebola, enhanced community education, risk communication, health promotion. All these contributed to protection of the community. So these factors were very, very vital in ensuring that, as opposed to other outbreaks, this one was brought to a rapid containment within 87 days. So usually when we declare the end of these outbreaks, the word we use that we declare the end of the outbreak or the end of human-to-human transmission. We don't say that the country is Ebola-free because the viruses continue to exist in the wild, among the wild animals, and whenever there's a close interaction between the humans and the animals that are carrying this virus, a new outbreak can start. So we always say that the human-to-human transmission or that particular outbreak has been contained. Now, the risk remains that if there is another interaction between a human being and an infected animal, that a new outbreak can start. What are we doing to ensure that we minimize this risk? The first one is ongoing health education. Even now on the ground, after the outbreak has been contained, there are teams still engaging with the population who are in this area to educate them on the risk of particularly consuming animals that are found already dead, which could have died from a serious illness such as Ebola. The second one then is doing what we call wildlife surveillance jointly with the animal health colleagues, so that we can be able to map out areas where there are animals which have been documented to have this virus.